Dr. Nattasuda Taephant, she is Dean of the Faculty of Psychology of Chulalongkorn University and also Director of the Center for Psychological Wellness and also the Vice President for the Thai Counseling Psychological Association and holds a PhD from Oregon State University in counseling. She's been actively involved in enhancing psychological services for Thailand, and she has a very interesting talk for us on trauma-informed care. I know many of us in the room look after people with HIV or at risk of HIV who have many mental health challenges, and because we're not specialists in this area, it's a very challenging thing to figure out what kind of services we need to be providing for them. So today, Dr. Nattasuda will address many of these. Thank you.
Thank you very much, Natalie, and thank you for having me here. It is my great pleasure to be here, and please be gentle with me as one psychologist in the very big room. So let's start. So we're gonna talk about trauma-informed approach. I think the first question we have to ask ourselves is what is trauma-informed care and why it is important. I think due to the previous presentation, we can see something that why trauma-informed care is very important. You're talking about you're taking care of the kids, right? Since they were kids, but when they grow up, there's something happen. And I think there might be some answer that you can get from trauma-informed approach. So when we talk about trauma-informed care, refer how the organizations and service providers think about and respond to survivor of trauma. Underline the word survivors of trauma. I think some question might come into your mind. What is survivor of trauma? And the patient that you're taking care of, are they survivor of trauma? I think it depends on how define what is trauma, and we're gonna talk about it later. And it's encompass an understanding of prevalence of trauma and its impacts on survivors and complex path of recovery. So I think this is the word that I might need to ask. What comes into your mind when you hear the word trauma? Positive and negative? Negative, thank you very much. A very good supporter. So negative, right? Think about the word of trauma is negative. You think it's very specific, might be like quite a big group of people who might encounter trauma. Should be someone who might be, I'm not sure, I'm quite old to think about the situation in Thailand, and people might consider trauma, it might be, how many years ago, tsunami, that can be a trauma. It must be like that. Or if you think about someone who might get people that label some negative thing on maybe on the parents, think about the parents or themselves. Can it be trauma? That when someone label you with the word HIV and you're a bad person, can that be trauma? When you grow up with that experience for more than 10 years, can it be trauma? So it depends how we're going to define trauma. And I think I put this slide on because I would like you to expand the definition of trauma. If you think about trauma as you losing loved one, if you think about trauma as like maybe natural disaster, that can be okay. But think about your patient as someone who might experience trauma before. And it might be a reason why it's very difficult for them to stay on track, why it's difficult for them to just like do the thing that they're supposed to do. Trauma might be an answer. So if we define definition of trauma as an event, but the thing that we talk is series of events, right? A circumstance that experienced by individual as physically or emotionally harmful or life-threatening and lasting adverse effect on the functioning of individual and mental, physical, social, emotional, and also spiritual well-being. If you remember the performance, right? The first set of words that the performers said is all negative, right? Talk about, I take down some note about the word that they said, talk about disgusting, sadness, fearful. Think about a group of individuals who've been labeling with all that negative words. Can it be counted as trauma according to this definition? So I think based on this, like I would like you to think about, might be some reason why your patient behave that way. And when we talk about trauma, we have to talk about three E's. So Sorry, I had 3-hour class this morning and I might cough a lot. So like, I'm still okay. So a traumatic event. So normally when we try to summarize what can be considered as traumatic event, sexual violence, right? Physical violence, violence come, witness some violence. And a very big group of Thailand is trafficking in person. I just share with Nat before that in Thailand we try to use trauma-informed care with a traffic person, but that's very good question. Why we don't talk much about trauma-informed care for HIV adolescents? So I think that's a question I cannot answer yet. We might need to try to answer this together, and also. And also there's some current research on HIV care that talk about a trauma-informed care for HIV adolescent that identify traumatic event for HIV patient as intimate partner violence. I think the next slide I may talk about percentage for female might be 80% in the US. So that's a very good example. That some traumatic event for HIV patient. And second one is about experience. So what experience that we can consider how even they encounter the event. So what experience that they perceive. This is very subjective and very unique experience. Some experience that might be traumatic for a person may not be traumatic to another. It's very like individualistic, and the experience is shaped by several factors, especially cultural beliefs. So there's some differences between culture, and also even you are in the same culture, but you have availability of the positive support differences. Like if you have a good one who taking care of you, have very good support system, even you experience the same event, the same incidents, you are tied the same group, but you have support system. This might be not be a like serious trauma as other group who might not get support. Now we're talking about an effect of trauma. So like a simple effect can be categorized in three things. You can see these all three together: emotional, cognitive, and physical response. I'm not gonna talk about physical response, but you might know better more than me, because it can be like affect some immune system when you have trauma. Like when you think about emotional. So when we talk about emotional, they may feel fear, guilt, especially talk about example in Thailand. Think about some domestic violence that happen. The kids don't think bad about their parents, that the parent is a bad one, but think about I might be someone that very bad. Why my parents treat me like this? Some might go back to spiritual belief about karma. This is a bad karma because I did something bad, so it happened to me. So the responses might be very different. For common cognitive responses, some research show that if you experience violence in the first year of childhood, it it can reduce 10% of potential to learning ability. So this is the thing that might happen to your clients. The second question, I asked about what is trauma. Now we say that trauma and how it experienced is very individualized, like especially difference between culture. How is trauma understand in your culture? I think I might start to share about how is trauma understand in Thai culture. So when you experience trauma, sometimes think about the karma. I say, because I did bad karma, so it happened to me. Some might think about spiritual belief that happened to me. Sometimes they might think about the emotion. Sorry. I take a real sip. So it should be better. So they try to observe the experience just in terms of physical only. There's some experience that work with a case of human trafficking. Thing about the trauma is because like they just blame on themselves and truly believe about because of the bad karma. So that's why it happened. You know, the question about trauma that I ask is not only for a culture of patient that you work with, but for your own culture as well. Because if you're going to work with clients, I'm sorry, I'm keep saying client from my, so patient for you have to understand your background, how you understand it as well. This is the research that I try to find. It's talk about trauma-informed HIV prevention. And they have statistic that I think is very interesting, and I think it would be great if we can see this statistic in Thailand as well. Think about trauma that happened to the patient. Look at the intimate partner violence. I think it's very high percentage. It's even like almost 68 to 95 for women, and even like 93 for transgender. So think about how many percent of your patient that might experience trauma. I'm going to go on this real quick. If you don't buy me on the percentage of the trauma experience for your client based on previous slide, I think you all know about ACE, right? It should be very famous, and you can see percentage that how many people in the worldwide will experience ACE and how it affects in the long run. So based on these slides that I just present, I think you should be with me, think about trauma might be an answer of some questions that you have. If you don't buy me yet, I think since I'm going to talk with lots of health profession, think about the brain, right? There's a scientific support, talk about the differences between the brain of kids with trauma and without trauma. So it affects for real. Now, if you with me about it affect for real, think about common trauma responses and think about the patient that you work with, any of them that might have some of these symptoms that they experience things that already passed, but they still feel like it's still there with them. They might might avoid something just like the coping strategy that they use a lot is avoidance and also hypervigilance, right? Numbness, self-medicating strategy, which is not good, right? And I think the last one is the thing that we see a lot. It's out of control emotions. So now we talk about what is trauma-informed approach. I think we talk about it more in details, in some manuals said you should present this slide first because people are gonna buy in and use trauma-informed care when they say benefits that they're gonna get. So trauma-informed care can help you work easier in terms of the relationship between patients. Now we talk about the principle of trauma-informed care. Think about what is the cause of trauma. It's unsafe, right? It's unsafe, it's unsecure. So the first thing you must do is assure safety, both physically and psychologically. I think I can talk about it in terms of principle, but in terms of how to apply it, like I'm from Thailand and I know caseload for the physician is very, very high. The big question after this presentation is how can we do it with like a very heavy caseload? But I think we have to try to find answer how to do it because we don't have other ways to help people who might have trauma feel safe without guarantee their physical safe and psychological safe. And also, environment is very important to make them feel safe. I think when you work with a child and adolescents, you have very good relationship with them, you have very good environment, right? But think about when they grow, when the presentation from professor from Chiang Mai University, that's some big issue in transition. And I think for me, when I listen to the presentation, I think about that's the change in safety. That's a huge change in safety. So that's why lots of things happen during the transition. And next one is also we talk about safety already, right? And next one is about trustworthiness. I think trust is a golden key for everything, right? Trust is golden key for everything. They're gonna follow you, they're gonna believe you, they're gonna follow the instruction that you give if they trust you, if they trusted you, right? And also peer support. It's mean if your patient can able to recognize potential supports for other journey towards healing, if they have support. And I think the way you deal with patient is not only one-on-one, right? You have a group of patients who together. I think in some project they might develop some group intervention. So I think it worked very well with adolescents. And also collaboration. So recognize everyone has role to play in trauma recovery. So that's why at the beginning when you talk about trauma, you need to adopt it in terms of organizational level, not only just like Dr. Nat, not only just like one individual, because it should be the whole organization. And the next one is empowerment, voice and choice. I think this is very important. So for patients with trauma, the important thing is they feel like they have no choice. They just like a victim of some situation that happened to them. So if you are able to help them recognize and build on strength and give a choice whenever possible, underline this is not only be applicable for trauma-informed care, especially when you work with adolescents. Giving a choice whenever possible is very, very good for adolescents, because in their developmental state, they want to feel like they have freedom enough to make a choice. They want to develop their own identity. So I think this is going to be like very work well for them. And last one is respect for diversity. I think this issue, it's very important when we talk about culture. We talk about cultural difference, right? We talk about stigma. We talk about labeling. And the diversity, I think in every country we have this issue. So start with us. We must aware in our own biases and stereotypes. We all might have, but we might not aware of it. And we might just maybe like communicate something without awareness, and it affect that individual that we work with. So we might need to understand, start with us to have awareness on what we maybe like have the biases. So I'm going back, sorry. Okay, now then my question is, since we have a principle, so what should I say about to do? So I think I choose a stress crisis trauma interaction. So if all of the patient have trauma, but how can we deal? How can we work with patient? I think at the beginning we start working on the stress first. Because, for example, for some individual to just pop up in a new clinic, that's stress, right? So stress normally is normal response, but how can we help that individual to solve this state? Don't make it like elaborate to be overwhelming. If it elaborated, it can be crisis and it can be trauma again. So when we talk about stress, I think this is psychology 101. You all learned about it a long time ago. So we think about mental, emotional, physiological, physical, right? How it affects. So in terms of mental, it's stress, feeling our thought about what is happening and what might happening. Like for example, if might be some like very loud voice or something, we all have stress. Like we might expect there's something bad happen, so that might cause some stress, right? So for emotional, the stress experienced through our feeling about what is happening or might happening, as well as the feeling about ourselves. For in terms of physiological, it's just the body, right? How our body respond. And in terms of physical is when our body meet with external challenge. The next step, if we don't want it to elaborate to be a crisis and trauma, I think go back to, when you're working someone in crisis, go back to ensure safety first. I think the simple word can be is safe here. I am safe for you, you are safe here. And I think when we talk about what can be ensure the safety, I think from the performance that you say, like you okay here, we don't label you, we don't think you are bad, because like this is the thing that happened, so ensure safety. Next one is be empathetic, so like you understand how they might feel. This is the thing that we just talked, right? And send a message that's very clear. concise. I think for me, when I talk with my student, it's like you just just talk one sentence message. Keep it clear, keep it short, keep it concise. That should be good. Like you said here, this is the thing you're gonna do. So stop. Just like make it clear and respect personal space. And this is very cultural based. How personal space, like for Thai, I don't know, like how we comfortable with personal space. I think I went to one international conference and we discussed about how much we can stand next to each other, how far. But I think the best way to say, are you okay? The way we sit here. So just check. This is very empathetic, right? We don't know how your patient perceive, and permit open verbal expression when possible. Allow them to talk. And set and enforce reasonable limits, of course, right? Keep your nonverbal cue non-threatening. This is very important. Nonverbal cue is very important when you communicate, right? So try to be aware and keep it non-threatening, and use physical technique only as one of your last resource, and debrief it. What can happen? What can happen? So I think these, if you do very simple thing, I think it's only 5 minutes, the first 5 or 10 minutes, it can help you working with that individual. So next one, if you work with individual who might be in trauma and it keep repeating, I think for me, my technique is identify trigger. Identify trigger. Each one of us, we have different trigger. And if you are able to identify your patient trigger, it can help you a great deal, and also it will help your patient a great deal. So when we talk about trigger, we have some, I think I have the slide about, okay, the common trigger. So like a trigger is something that sets off action, process, a series of events. So like, for example, think about the performance. Like the trigger for adolescents who have HIV, they might say like when people look at them and just, they might not say nothing about themselves, but that's a trigger and feel like this is the thing that might unsafe. So right, try to help them understand it. Normally, universal trigger can be loss of control, power differential, and lack of predictability. Think about your patient. Do they have control? Do they feel there's a power equal? No. And lack of predictability. This is the thing that they experience. So when they have lots of trigger, yes, they're gonna tend to have negative emotion, and sometimes they just like burst out. So this is the thing that happens. A signal that you can see, might be something that they got triggered already. So something, that signal that can be observable, like restlessness, agitation, pacing, short of breath, and sensation, tightness of chest and sweating. So that's something that can happen to any individual that you work with. Last but not least, we talk about the thing that you should be aware. That's a trigger, and the emotion might be escalate, right? But I think I'm very keen on positive psychology. We talk about trauma, how it affects, right? It might be difficult to work with that individual, and we need to help people with trauma with empathy and ensure safety and think about trigger stress. But you know, the second set of things that can be very helpful is identify positive coping strategies. And you know, with adolescents, they have lots of potential. They might have some coping strategy that they are able to do already. But if you keep doing positive coping strategy, you will reduce negative coping strategy at the same time. So as the physician, as the individual who means a lot for them, if you can help them to practice some strategy that manage and minimize stress, they will be able to work on their stress, and they will be able to work on the emotion better. So maybe like just taking time away from stressful situation, going for a walk, find some space, right? And talking to someone who will listen. Think about who's identify who's that person for them. Listening to peaceful music, taking a nap can be help. Coloring is very helpful, right? Deep breathing, writing a journal, praying or meditating based on their religion belief, that can be very helpful. And you know, this can be a list of activity that you discuss with your patient about what they can do in terms of like help themselves to be better. I'm about to talk to the second last slide. We talk about trauma-informed care, talk about what intervention that might be possible. Another word is if you are able to help them if you are able to provide some psychological first aid for some time can be very helpful. But the thing that I highlight is effective communication. In this 15-minute talk, if you cannot remember anything, just remember the word safe environment and active listening. We talk about the brain, we talk about how trauma might affect and how they might be re-traumatized. It might not by you, but by other things. But when they are with you, if you can provide safe environment by having effective communication, listen to them, help them to feel this is safe here, I think this is very good start. So I think if you are able to provide effective communication, the process of trauma and re-traumatize gonna stop. They're gonna keep learning that this is safe place, this is safe place. Of course, when trauma happens, it's there for a long time because it's in their brain, right? It's in their experience. But if they are able to learn that right now, the place that the place here is safe place, I think you can work on other things after that. So, to sum up, when you employ trauma-informed approach, it will become easier to communicate effectively with your patient. You can help patients get help that they need because they're going to communicate with you. And last but not least, I think this is the thing that's very important and you might forget about it for some time. It's also reduce your own list of being negatively impacted of others' trauma. I mean to say ขอบคุณค่ะ in Thai, but I have last drop is ขอบคุณค่ะ in Thai, what does it mean? Thank you, right? But a real thank you is not because like you are very nice, listen to me, but a real thank you should come from I hope this session might inspire you to think about a question that what else we can do to help patients. Because like for me, even I'm in Thailand and we work on trauma-informed in so many group of people, but we don't work on HIV adolescent patients yet. So there's some current research that talking about trauma-informed HIV care, a holistic approach, and how it can be helpful in terms of both quality of life, like what you said, and I think about it can be helpful in terms of like psychological well-being and even like depression. So when you talk about depression, if you think about the performance, like all words that got labeled, sick, what else? But when it change, so if we can change the stigma situation and we can destigmatize, that can be something that happen in terms of ecological level for our patients. Thank you very much.
Thank you so much for that talk, Professor Nattasuda. And yes, I think the two things I'll remember from that talk is safe space and active listening.
And the last talk, we have an honor to discuss about one of the risks of long-term NCD in